Coronavirus pandemic could cause wave of brain damage, scientists warn. The novel coronavirus pandemic could lead to a wave of brain damage in affected patients, warned British researcher in a new study released Wednesday. Experts at the University College London were the latest to describe that COVID-19 could cause neurological complications, including stroke, nerve damage, and potentially fatal brain inflammation, even if the patient didn't show severe respiratory symptoms associated with the disease. We should be vigilant and look out for these complications in people who have had COVID-19, said Joint Senior Author Dr. Michael Zanvi in a UCL press release, warning that it remains to be seen whether we will see an epidemic on a large scale of brain damage linked on the pandemic. Follow-up studies will be necessary to understand the potential long-term neurological consequences of the pandemic, they said. This study, published in the journal Brain, examined 83 patients treated at the University College of London hospitals for either confirmed or suspected coronavirus. From April to May, they varied in age from 16 to 85 and show a range of mild and severe symptoms. Among these patients, a researcher found 10 cases of temporary brain dysfunctions and delirium, 12 cases of brain inflammation, 8 cases of stroke, and 8 cases of nerve damage. Most of the patients who showed brain inflammation were diagnosed with a specific, rare, and sometimes deadly condition known as acute disseminated encephalomyelitis. Before the pandemic, the research team in London would see about the ADEM patient per month. During the study period, the number rose to at least 1 week. One woman hallucinated lions and monkeys in her house. Others reported numbness in their limbs and face, double vision, and disorientation. One severe patient was barely conscious, responding only when in pain. Researchers are still trying to figure out why exactly COVID-19 patients are developing these brain complications. The virus that caused COVID-19 was not found in their brain fluid, meaning the virus does not appear to directly attack the brain. One theory instead is that the complications are indirectly These findings are significant for informing how doctors around the world monitor and treat patients, but they also pose new questions and challenges. For patients who aren't showing severe respiratory symptoms such as trouble with breathing, it can be difficult to identify this brain complication early enough to prevent or minimize damage. And for patients who are critically ill, their precarious health can limit how much doctors can do to investigate what happens in their brain. The authors warn the further studies will be essential in figuring out how exactly the virus causes brain damage and how to treat it. Given that the disease has only been around for a matter of months, we might not yet know what long-term damage COVID-19 can cause, said Joint First author Dr. Ross Patterson in the press release. Doctors need to be aware of possible neurological given that effects, as early diagnosis can improve outcomes. Dr. David Strain of the University of Exeter Medical School, who was not part of the study, called the findings important but not surprising given previous coronavirus cases. The main limitation is that we don't know what the denominator, so we don't know how frequently this complication arise. He said in a statement on Wednesday, "We've already seen that some people with COVID-19 may need a long rehabilitation period, both physical rehabilitation such as exercise and brain rehabilitation. We need to understand more about the impact of this effect on the brain."
Tell me pretty lies, look me in the face. Tell me that you love me, even if it's fake.